Okay, thank you so much for the introduction. So welcome everyone to our first talk in the series of career guidance lectures that we'll be having. So today we will be talking about the application process to medicine. You've already heard our introductions, but just to reiterate, my name is Aparna and I'm a fifth-year medical student currently studying at Cardiff University. We also have here Lakshmi, who's a third-year medical student at Nottingham, and Ivan, who's a second-year medical student at Imperial. So we'll get started now, and I'd like to hand over to Ivan to talk us through our first topic, which will be on why you should choose medicine or deciding whether medicine is right for you.
Yeah, thank you for the introduction. And so the most important thing of the application process is going to be deciding on medicine as your university course and also your career path. And there's many reasons why you might feel like medicine is the right career path and the university choice for you. And I've listed here some of the reasons that are most common and also quite useful to use both in your personal statements and also your interviews. I think the first reason that people often think about why to choose medicine is that you get to make a real, unique difference in someone's life. Medicine, compared to lots of other career paths, offers you the power to change someone's life when they are most vulnerable and in most need of help. And that's a really strong reason for why medicine might be a really good career path. Additionally, we get to use scientific knowledge and clinical skills to treat and support patients. So not only are we learning more about the human body, we are able to use that knowledge clinically to help improve patients' lives. Thirdly, there are a multitude of specialities to choose from anesthetics to obs and gynae, to cardiology, to neurology, to musculoskeletal as well. You're guaranteed to find a subject that you are interested in, and you can pursue that to become as part of your career. And the really interesting thing is that once you specialize, you'll be able to appreciate the complexities of the subject in greater detail and become one of the world-leading experts in that field. Fourthly, you get to work in a team. That's one of the main advantages of studying medicine. You're never on your own. When treating patients, you are always with a multidisciplinary team of nurses, consultants, and other doctors who can help you make decisions in the best interest of the patient. And whenever you are unsure, there are always others around you that can offer guidance and support. And lastly, if you're interested in research and teaching, medicine is definitely the career for you. There's lots of opportunities to do research, both at medical school and as a doctor, and also teaching opportunities are vast. Again, by tutoring other medical students at university, but also becoming a clinical teaching fellow at doctors, and later on becoming a professor or lecturers at medical school. So despite all of these advantages, there are some things to be aware of when choosing medicine as a career. First of all, it is very demanding. Not only do you have to go through 5 years of medical school, 5 or 6 years depending, you also have to then go through the foundation program and the long years it takes to become a consultant in your field. And that can be very difficult and may require a lot of hard work. And building on that, there's also long working hours. So you might be working unsocial hours, sometimes doing night shifts, sometimes working over the holidays. And that's something you have to bear in mind when deciding this career path. I think thirdly, it can be a very grueling process in terms of training pathway. As I said before, there's a 5 or 6 year university course, but also depending on your specialty, there can be many years it requires to become a full consultant, and that incorporates lifelong learning. So you never finish learning after medical school. You continue developing your skills, progressing your portfolio until you eventually become a consultant. And lastly, there's imposter syndrome, the feeling that you are not good enough or that you don't belong here. And that's a very common feeling felt by medical students and doctors alike. And it's something you will have to cope with if you decide to choose medicine as your career. So in conclusion, there's many advantages that make medicine such a satisfying and rewarding career, and definitely something you should go towards, but do keep the difficulties in mind and challenges to make sure that you can overcome them.
Just a note, please can you try not to draw on the screen because it's quite distracting for the presenters. So please don't click on the annotate button and draw things on the slide. Thank you.
Now, when it comes to deciding what subjects to do at A-level, one thing to note with medicine is most universities, if not all of them, require chemistry as a minimum. So if you only have 3 subjects that you can take, definitely make sure that chemistry is one of them. And also, there are some universities like Nottingham, Cardiff, where biology is also a requirement. So definitely, first thing you should do is when you're deciding what university you want, what universities you want to apply to, check on their websites for the entry requirements and see exactly what subjects they're hoping for, because you don't want to pick your subjects at A level and then realize later on that you haven't got the right ones for medicine. So keep that in mind. So yeah, chemistry, and then potentially biology as well. And then most other places, if you've got chemistry, you need one other science, so either physics, biology, or maths or further maths. Usually schools don't let you do further maths if you don't have maths, so just maths is usually fine. And then most places need a minimum of 3 A's or above. So 3 A's, an A star in there, that would be great. Bear in mind that most medical universities, the most successful applicants are usually a combination of triple science, so maths, biology, chemistry, or 2 sciences and maths. But that doesn't discount you from doing anything else. So if you wanted to do chemistry and biology and then a 3rd subject like drama, which is what I did at A level, that is completely fine. You can still get into medical university. So don't think, oh no, I have to do all 3 sciences or I have to do maths. Chemistry with one other science or maths is usually enough for most medical schools. Even Oxbridge, their requirements are chemistry with another science and maths.
Okay, so now we're talking about what kind of extracurricular activities and volunteering that you can get involved in as part of your medical application process. So doing extracurricular activities and volunteering, it's a great way to show to the selection committee that you have the skills that are needed to become a doctor. And some of these skills include empathy, communication, teamworking, leadership, and there are a multitude of different activities that you can take part in to showcase these skills. So, for example, these might be things that you're already doing, such as playing a musical instrument or doing dance or doing a team sport, because these are all activities in which you can develop these particular skills. And volunteering is another great way to, again, develop these skills, but also show that you're willing to put in time and dedication towards a particular task, even though you get no kind of monetary benefit out of it. So this could be things such as volunteering at an old age care home or a refugee centre or a homeless shelter, or even mentoring younger students as well. And through these various different activities, you can develop your communication skills and also your teaching, which are all going to be very important in a medical career. So think about what kind of activities you can involve yourself in to develop these particular skills, and think about how they will actually help you in a medical career as well. And these are questions that you should think about, because when it comes to the personal statement or their interviews, these skills will be asked a lot, and you would have to come up with examples of where you've demonstrated this skill or are working on this skill. So it's very good to engage yourself in these activities and volunteering. And try to do more kind of long-term activities. So like 6 months to a year is more valuable than having a very one-off event or like going to a 1 or 2 volunteering sessions, because again, it shows commitment and dedication to a cause. And it doesn't matter where you volunteer as well. So some people struggle to volunteer or do activities within a healthcare setting. So it doesn't matter. You can always transfer skills that you learn from a different setting. For example, say if you were an assistant chef at a local restaurant, you still pick up skills such as team working and leadership, and you can still apply that to a medical career as well. So it doesn't matter if you don't kind of get work experience or volunteering within a healthcare setting. Try and get a varied amount of opportunities, and you can always transfer those skills to your medical application process and also your medical career. And some useful places to look when you're searching for these extracurricular activities or volunteering. So you can turn to your local community and local organizations. For example, I was a youth leader at my Malayali association. So you can even look to your associations as well and get involved in any activities or opportunities that they present. Also, you can look at kind of local shops or care homes or the library and think about whether you can do volunteering or other activities there. There's also something called the National Citizen Service, which is, I think it's a 4 to 6 week program that's government funded, and it offers you the opportunity to undertake team working activities and also develop a fundraising program and fundraise for a particular charity. And again, you develop these particular skills that we talked about earlier through activities such as this. And if you're looking for volunteering opportunities in general, there are useful websites out there, such as the one I've listed on this slide, so doit.life/volunteer. You can look on there for local opportunities for volunteering as well.
Yeah, so in addition to work experience, in addition to volunteering, another thing you can do is work experience for your application. And the key message here is reflection. It doesn't really matter what work experience you get, as long as you're able to reflect on that, show what you've learned from it. That's the key thing about work experience. So the point of work experience is twofold. First of all, it shows your interest and passion for medicine. And secondly, it's good to demonstrate that you have a realistic impression of the medical profession. So what I mean by this is that you're able to understand both the advantages and some of the challenges that come with a medical career. And some examples of work experience are obviously hospital work experience, where you get to shadow a doctor, an F1, maybe some nurses or anyone working within the medical team within the hospital. Perhaps you might be able to get a GP work experience, following one of the general practitioners at a local GP and seeing what a day-to-day clinic life looks like. Thirdly, there was this really good opportunity by Brighton Sussex Medical School, which is a virtual work experience, which you can do online. And that provides a good asynchronous approach, particularly it was created during COVID, but it gives a good opportunity to get like a good range of opportunities in different fields as well. Thirdly, because it's definitely quite difficult to get hospital and GP work experiences, you can also go to your local pharmacy or charity shop, and that also counts as a valid experience. But again, the key point is reflecting on what you've learned, seeing how this can be applied within the medical field, and writing about this in the personal statement, and also having reflective thoughts ready for the interviews if they bring it up. And do remember, when you go on these work experiences, particularly within the hospital and GP environment, always take with you a small notebook where you can write key moments or key conversations you had with the doctors or patients that you can then reflect on and write about in your personal statement. Great, so now we've looked at extracurriculars, your A-levels and your work experience. Now the final part of the application would be the UCAT and the BMAT. So these are two aptitude examinations that are sat depending on which university you want to go into. The UCAT is the test that the majority of universities do, and the BMAT is for a select few universities that have been listed at the top, mainly Oxbridge and London universities. So the UCAT is a computerized test. It lasts 2 hours and it's made out of 5 sections: verbal reasoning, decision making, quantitative reasoning, abstract reasoning, and situational judgment, also called the SJT. And how this works is that you'll get a random allocation of questions on each of these sections, and you'll be scored between a score of 300 to 900 in each of these sections, and that will give you a total score out of a certain maximum. One thing you have to note is that the SJT is not scored numerically, but it's done according to bands, from bands 1 to 4, with band 1 being the highest. Tips that we would recommend for the UCAT is definitely make a Medify account. Medify is a website that has all of the past paper questions for UCAT, very well formulated within a digital frame. And this is very good at replicating how exactly the exam questions will be like in the real UCAT exam. So definitely would recommend you making this account. Additionally, if you want any extra practice questions, you can use the UCAT ISC medical book, which can be accessed either through your school libraries or can be found online. And now that we have lots of YouTube videos from medical students at all universities, you can find their tips and tricks as well, easily available on YouTube. In terms of actual test taking, the #1 tip is doing as much practice as you can. and doing it within timed conditions, because one of the most difficult things about the UCAT is that it's very, very time pressured. Once you've got a good amount of practice in and you know each of the sections very well, it's good to focus on your weaker sections. For example, usually the hardest sections are the abstract reasoning and the quantitative reasoning. So focusing on those reasons so that you can get a good overall score. In terms of timing, the UCAT will be sat in your year 12, and you can book the date anywhere between the 1st of July to the 1st of October. And this will be sat in an external exam center. And the process is quite simple and is all very well explained on the UCAT website. The second examination you have to do is the BMAT, and this is only if you want to apply to these select universities. The BMAT is also 2 hours, but is split into 3 sections. The first section is problem solving and data analysis. The second section is about scientific knowledge, which is assessing you on your GCSE level of biology, chemistry, maths, and physics. And the last section is an essay, which you'll be given 3 questions on the day, and you'll be able to choose one of those questions to write your essay on. In terms of the scoring, section 1 and section 2 are scored out of 9, whereas section 3 has 2 components. It's scored from 1 to 5 for your content of the essay, and you get a score from A to E, depending on your SPAG, so spelling and grammar. Again, the number 1 tip is practice questions. There are a whole lot of past paper questions easily available online of all the previous years of BMAT, and as long as you can do all of these questions within time and conditions, that will set you very well for the real exam. For section 2, I would strongly advise practicing your maths and sciences at the GCSE level, because that is exactly what comes up in section 2. Do also use whatever you've learned currently in year 12 for the A-level knowledge, because that can help with you any of the harder questions that come up. And thirdly, the essay is the section that many people find most difficult, and because it requires lots of logical reasoning and clear layout of arguments. What I found most useful for this section was practicing on my own, maybe sending out some of my essays to my teachers and getting feedback from them, and also practicing with my fellow medical applicants at school, and on a weekly basis discussing my essays with them and getting good feedback. In terms of timing, the BMAT is sat in October, and it can be sat at your school depending on whether your school is an exam center for BMAT, or it can be sat externally as well. One key thing to note for applicants who will be applying in the next cycle, in 2024 onwards, the BMAT will be discontinued, and we're still awaiting any news whether it will be replaced, but that's nothing to worry about, that's the future thing.
Okay, so now how do you choose which medical school you should apply to? So you have a wide range of choices. So there are around 37 medical schools within the UK, and you apply to 3 of these. And we thought it would be best if you make a comparisons table to help you compare between the different medical schools that you're considering. And some of the factors you can consider include the course structure. So what kind of layout and learning style do they use to teach medicine, and where do they introduce placements, and what kind of examinations or assessments do they have? So really find out more information about the course structure and the syllabus of these different university courses. And you can find all of this information at the university's website. Another thing that you can consider includes the fact that whether they offer dissection or prosection to teach human anatomy. So dissection is when you yourself get involved in cutting up body parts to help learn anatomy, whereas prosection is when body specimens have already been cut up and presented to you by staff. So this requires nothing from you. You just go and examine those sections that have been provided. So think about whether you would prefer dissection or prosection, and that can help you narrow the universities down as well. Another thing to think about is whether it's a city or a campus university. So with a city university, the university buildings are dotted in and across the city, whereas a campus university, all of the university buildings are found in one area. So think about which one you would prefer as well. And all of this information should be easily available to you at the university's websites. Finances are also quite important to consider, because some cities require a higher living cost as opposed to others. So think about how you would get in and around that city. Does it have good transportation? Think about your living expenses as well, because it can help you prepare before you go to that university as well. So some places like London and Oxford have a higher living cost as opposed to other places. So you might want to take a part-time job before going to university to help you build up the finances you need to live at uni. And also, it's very, very important to pick a city that you really like the look and feel of, and that you would enjoy living there in, because you will be spending quite a long time at this particular city. So 5 to 6 years of your life you'll be spending there. So do pick a city that you like the look and feel of, because you don't want to start hating it after living there for a while. And another thing that you can consider are the kind of societies that the university offers. And what this means, so societies are student-led organizations, and they help you do activities that you enjoy. So whether you like dance or a team sport, or another activities such as crochet, there are so many different societies that are on offer at each of the different universities. So do check them out using the student union websites, and they should have a complete list of the societies that the university offers as well. And this is also useful to know, because at the interviews, if they ask you a question like, why do you want to come to this university? Then you can say, actually, these societies really interested me and I would love to get involved in them. So it shows that you've done your research as well about the university, and they're more likely to pick you that way. Another thing are the placement areas. So as a medical student, you will be spending a lot of time in placement, and this means hospital or GP attachments, where you spend time taking histories, doing clinical skills, examining patients. So check what placement areas are on offer at each university. So if I speak about myself, so I go to Cardiff University, and we have placements across Wales. So we have placements sometimes up in North Wales as well. And the university offers accommodation for us to stay there whenever we do have placement within North Wales. So the advantage of this is that you get to see patients from all kinds of demographics, as opposed to just seeing patients from one area. So that could be something that you consider as well when applying. And medical students who are currently studying there are your biggest resource in trying to find out whether you really would enjoy your time at that university, because they will be able to tell you from their own experience what studying at that particular university has been like. So definitely get into contact with medical students who are studying at the universities that you're looking at, and find out, what is it like to study there? Are there any things that they like? Are there any things that they don't like? So really inform yourself through these valuable resources. And finally, another thing that you may consider would be whether they offer intercalation. So Nottingham actually offers intercalation within their 5-year course. So Lakshmi will be able to tell you more about this, but in 3rd year, they have some dedicated time to pursue a different degree. So intercalation is basically when you take a little bit of time outside of medicine to pursue an area of your interest. And this can be many, many different things. Check each of the different university websites to find out what intercalation degrees they have on offer. And usually they offer this intercalation after your 3rd year or 4th year at university. And usually it's 1 whole year out to get an additional degree. So this would mean that when you graduate, you get the MBBS degree, but on top of that, you get a BSc as well. And this can be useful in specialty applications later on in the future. So it's something to consider if whether you like the kind of intercalation degrees that are on offer at particular universities. And you can always look at this information at the specific universities' websites. And it's very important as well to attend open days, speak to the staff and students there, and really get a feel for the university, because you don't want to end up going somewhere that you actually don't like. So really think these things through to help you make a very informed decision. And this is just an example comparisons table that I made earlier, and you can add your own rows and columns in depending on which criteria you want to look at. And they can be some of the things that we've already discussed in the previous slide. So what kind of courses are there on offer, and what kind of structures are there? So the traditional format was what most medical schools followed in the past, but now only Oxford and Cambridge follow this format. So this is when you have preclinical years, which are typically years 1 to 3, in which you cover the basic anatomy, physiology, pharmacology, all of these in a lecture format, as well as a small group learning, followed by 3 years of clinical years, in which you put that theory to practice through seeing patients and doing history taking and examinations and so on. So currently, only Oxford and Cambridge offer this format. Most other medical schools offer one of the other formats, which is a more integrated, or using a combination of different approaches towards learning. And the key thing about these other formats also is that you get early patient contact. So from first year, you will be going into placement and seeing patients and practicing those skills of history taking and clinical examinations. And typically, an integrated course will be a combination of lectures and seminars and clinical skill sessions, as well as small group learning, as well as you have placements from first year. And then PBL and CBL, in addition to those lectures, you have small group learning in which you look at particular cases and work around that case. And I'll tell you a little bit about what case-based learning is like. So that is what studying at medicine at Cardiff is like. So we have something called case-based learning, in which in our first 2 years of university, we have the basic anatomy, physiology, we cover all of these things, but also additionally, every week we meet up in groups of 10 and we discuss a particular case. So for example, our first case was a musculoskeletal case in which we discussed a patient with a knee injury. So in that case, we would then discuss the anatomy of the knee and the physiology of the knee joint and things like that to work up our knowledge, our medical knowledge, as well as input how to speak to patients and how to examine patients quite early on from first year. And after the first 2 years of doing case-based learning and more the theory side of things, alongside a few clinical placements, we have our more clinical years from years 3 to 5, in which we are basically on placements most of the time, in addition to some lectures here and there explaining different conditions, etc. So that's what case-based learning is like. So this year, actually, I am intercalating and I'm taking a year outside of medicine. And what I'm doing is a course called Cellular and Molecular Pathology. So in this course, we're looking more at the immunology side and learning more about that. And also in this year, I get to undertake a research project and produce a dissertation at the end of this year. And I'm happy to answer any questions about intercalation later on as well. So I'll hand over now to Ivan to talk about what studying medicine at Imperial is like.
Yeah, so Imperial follows an integrated format. So we do have, so the first 2 years are pretty much preclinical, but we do get hospital placements at the end of each year, at the end of year 1 and at the end of year 2. Then year 3 is a full clinical year, where we have 3 rotations, 1 GP rotation, 1 surgical hospital rotation, and then 1 medical hospital rotation. In 4th year, we take a year out to do our integrated BSc, and 5th and 6th year are hospital placement years. In terms of the curriculum, we have lectures pretty much throughout the week. Then we have tutorials on the lecture content, maybe twice or 3 times a week. And then twice every term, we have some cases as well, which are kind of supplementary to our lecture taught content. And they're also quite useful in terms of getting a real life example from a real life patient.
And then when it comes to medicine at Nottingham, it's split into the first 2 years will be your preclinical years. Your 3rd year, from September to January, you'll be doing your intercalation. So at Nottingham, everyone does an intercalated bachelor's of medical science. So there'll be a list of projects that you'll be given on a home basis, and you have to like rank the order of projects that you'd like to be on, and then you'll be allocated to a project and you'll work on that project from September to January of your 3rd year. And then from February to your final year, you'll be working on, you'll be doing clinical years. So you'll do 6-week rotations on different areas. So I've just finished my intercalation and I'll be starting clinical placement soon. I'll start my 6-week rotation of GP and then surgery, so on. And at Nottingham, the teaching in the first 2 years is lecture based. So all of your content you will learn through lectures, but then you will have seminars, maybe weekly or fortnightly. You'll have dissections once a week, every week from December of your first year through to, I think, midway through your second year. And at Nottingham, the interesting thing is that they do full body dissection, which I think only 6 universities in the UK do now. But you'll be working on one cadaver for the whole of first and second year. So that's dissections. And then there's also clinical skills sessions, small group learning, and the opportunity to meet up and learn together. And then also we do get given a case study each week that covers the content for that week. So say if you have a 3-week period of gastrointestinal medicine, the first week might be malnutrition, the second week might be pancreatitis, and the third week might be ulcerative colitis. And for each of those weeks, you'll have a case that is malnutrition, pancreatitis, ulcerative colitis. At the start of the week on the Monday, they will release the first few details about that case. And then each day that week, they will release more and more details about the case. On the Friday, your final lecture will be a 2.5 hour plenary that wraps up that case and all the content you learned that week. And so you'll be able to follow through the case and the questions that were related to the case, but you work on the case alone. It's not like other universities where you'd work through the case in a small group. So yeah, you will learn the majority of your content through lectures. So you'll cover the anatomy, the physiology, the histology, the pharmacology, all of that. But you'll be able to work through the case weekly, and you'll have the small group seminars, clinical skills teaching, all of that to supplement your learning.
Thank you, guys. So that's just an overview of what the different course formats can be, but I would highly suggest to do your research and try and find a course that you would like learning, that particular learning style that you are most suited to, because otherwise you'll have a difficult time fitting in and trying to learn medicine that way. So try and pick a course that your learning style most matches to. Okay, so now I'll be talking about the personal statement aspect of the application. So what this is basically a 4,000 character essay highlighting your reasons for wanting to pursue a medical career, as well as explaining why you think you are suitable to become a doctor, and also showcasing all of the different extracurriculars and work experience and other skills that we talked about in the previous slides. So this is a part of the application process in which you can show all of these different aspects to help the selection committee find out more about you and convince them why they should select you, really. So one of the main things about the personal statement is that what we would say is that you want to avoid cliches, because a lot of people will say that they love science and they want to help people, but that's everyone who wants to kind of apply to medicine or a healthcare degree. So saying something like, I love science and I want to help people, doesn't make you stand out. So you need to find reasons that really underpin why you want to study medicine, and try and be unique in that as well. And a way in which you can do that is by talking about your unique examples of whatever skills that you have accumulated over the years doing your particular extracurriculars and volunteering activities, as well as the unique work experiences that you have gained as well. And Ivan already mentioned during work experience, or even in your extracurriculars and volunteering, it's always really good to reflect, because we want, the selection committee want you to know why you are developing those skills and how they are applicable to medicine as well. So when providing these examples of your skills and your work experience, you really want to tie that in with why medicine is right for you as well. And expect to go through many drafts. So I think I went through around 27 drafts of the personal statement, and that's not even a lot. Some people have gone through like 40. So start getting prepared quite early on, and write drafts, get your teachers to check your drafts for you and give you suggestions for improvement, as well as ask doctors and medical students to check over the personal statement as well, and they will be able to give you very good feedback and ways to improve and write things. And yeah, expect to go through many drafts, and it is a long process, but the earlier you start, the better. So usually you have to submit the personal statement in October time. So we would suggest kind of starting in the summer, early summer, and getting the main points of the personal statement down, and then you can bulk it out later and add bits as you go along through the drafts. And another thing is that you shouldn't just list everything that you have done. The committee are not looking for the person who's done the most work experience and the most amazing volunteering and work experience, and they don't want to see a huge list. They want to see what you've learned from doing these particular activities or doing the work experience. So even if you pick 1 or 2 examples for work experience or 1 or 2 things for volunteering, but you explain that really well and say, actually, I've developed these skills from doing these activities, and this makes me very suited to become a doctor. If you explain that, then that is so much better than writing down 20 different things that you've done, but not showing any reflection at all. So please reflect on whatever activities you take part in, because it will really help you later on when it comes to things like the personal statement and the interviews. And here on the right, we've just listed an example outline that you can follow. So in the introduction, usually you you explain your reasons for choosing medicine and why you want to pursue medicine. And then you can talk about kind of the steps that you took to explore the career, whether that's work experience or any wider reading that you've done or any research that you undertook to find out, actually, medicine is the right for me. And you need to show an understanding that this is the career for you. So despite all of the kind of negative side as well, because there are negatives to medicine too, which you should be aware of when you're considering it, such as long working hours or, burnout and things like that. So be aware that you understand medicine as a whole, not just the positives, because you don't want to sound naive in your personal statement either. And you can then talk about the kind of skills that you have gained to prepare you for a medical career, and this would be your volunteering and your extracurriculars. And finally, you want to conclude everything in a nice conclusion, speaking again about your motivation behind pursuing medicine and why the selection committee should pick you. So another thing to note actually is that the personal statement is being removed after this year's application process. So within from 2024 onwards, it will be changed to questions. So the UCAS have published a statement saying that they are removing the personal statement after this year. So people applying this year, you're the final year to actually have the personal statement. And this is applying to all courses actually. So it's instead going to questions which are addressing your reasons for choosing a particular course. So not just medicine, everything all the courses that universities offer will be changing to this format. And the questions will be on these areas. So motivation for the course, how prepared you are for the course. So what kind of things have you undertaken to help you prepare? And that's your learning as well as your other experiences in the next section. Any extenuating circumstances that they should know about, how prepared you are for student life, and also what kind of particular learning styles are most suited to you, or assessment styles are most suited to you. So these are all questions that explore these different areas. And actually, if you look at these questions, it's very, very similar to the personal statement in that you have to talk about your motivation for studying medicine, but also how prepared you are, as in what skills have you gained through your work experience or volunteering or your extracurriculars. So it's basically a breakdown of the personal statement, but they've made it into, they claim, a fairer application process, but that will be, again, from the 2024 admission cycle.
Okay, so when it comes to interviews, one thing to note is that interviewers aren't expecting you to be the perfect mini doctor. So already they're not expecting you to know everything about medicine, everything about science, everything about treating, diagnosing a condition, all of that. That's not what they want. The main thing that interviewers look for is that you have the right type of critical thinking skills and situational judgment and the right persona for medicine. So are you empathetic? Are you able to think through a situation chronologically with logic and common sense? Are you able to deal well under pressure? That's the skills that they're looking for. So we've said transferable skills, transferable skills, transferable skills. That is what they're looking for. Have you got the right skills to be able to adapt and survive in medicine? In terms of interviews, there are two types of interviews. There's the traditional panel interview and the MMI interview, so the multiple mini interviews. The traditional panel interview is not as common anymore. Places like Oxbridge use it, I think, and a few other universities, but now the more common one is multiple mini interviews. So traditional panel interviews can be quite specific to you. So if in your personal statement you have mentioned a specific work experience you have done or something you have done in volunteering, they may ask you to elaborate on that and say, can you tell us about how this makes you suited to medicine? How has this work experience made you suited for medicine? Important thing to note also is that Oxbridge interviews especially, they can ask you seemingly bizarre questions. So it might be something like, I think Abarna had it, where they showed her a bone and said, what bone is this animal? What animal is this bone from? So it might seem very random, but what they're looking for is for you to explain your thought process. How have you arrived at this? What are you thinking through? Are you thinking through it chronologically? Are you thinking through it with some sort of critical thinking? That's what they're looking for. So again, it's not really your answer that they're looking for, it's your thought process and whether that can be adaptable to medicine. So that's the panel interviews. And then multiple mini interviews are not really specific to you. So they won't ask you things from your personal statement specifically, because they can't look through that many personal statements and ask you things like that. But they may ask you a slightly more open-ended question. So they might ask you, explain an example in which you have displayed empathy, or explain an example in which you have learned from your work experience. And it's basically to show reflection. It's to show how you have the skills and how you've reflected on your experiences to develop your skills. Multiple mini interviews follow a different format in the panel interviews. In that panel interviews, you'll be sat in front of a panel of interviewers. I think Oxbridge or Oxford, they do two separate panel interviews in one cycle. So you'd have to do two different interviews. Multiple mini interviews, you go in, there'll be around 6 to 8 stations. You might have up to around 5 minutes for each station, and they test various different skills. So in one station, you may have an actor role play situation where you'll have an actor, an examiner. You don't speak to the examiner. You'll get given the prompt for whatever the station is, and you'll have to speak directly to the actor. So it may be a situation where it's your friend and they've stolen something from a shop, and you have to explain to them why this is bad and how to deal with that, but you have to show empathy because it's your friend. And it's really just trying to see how you'd navigate that situation and how you'd balance both sides. Then there can be skill stations. So in my interview, I had one where it was a urine dipstick. So they had a jar, it had urine in it, and you had to test it with one of the urine dipsticks that they'll provide for you. Obviously, I didn't know anything about doing a urine dipstick test, and that they're not looking for you to know exactly what it is. What they're looking for is to see that you know how to structure yourself so that you're doing it in a logical way. How are you setting up the station? How are you going through it in a systematic way? And how are you explaining yourself at the end? And how are you explaining what you're doing throughout the station? And then you may have other ones where it's problem solving. So you have to order the events at a crash and who you would treat first, or medical ethics, where they may ask you about the GMC's pillars of ethics and how you have applied that in your work experience or day-to-day life or extracurriculars, something like that. Breaking bad news is another one, breaking bad news to the actor. So yeah, there's different skills and you're being tested on different skills rather than being asked questions directly to yourself. One thing to note for both styles of interviews, it's very important to read up on current medical events. They're not expecting you to know everything about medicine, every new invention, every new discovery, recent, nothing like that. But if you're watching the news every day and you see an interesting case, you can apply that when you're being asked questions. You can say, recently I saw a case about this. It was really interesting that the doctors responded like this, or that the medical community responded like this. That's good to show that you've been doing wider reading. And then also definitely look up the 4 GMC pillars of ethics. I think there is a handbook called the GMC's Guide to Good Medical Practice. That is very good. It's a very good read for any medical applicants. So yeah, definitely read up on those 4 because you can always apply it in your questions. Tips would be to practice with your friends and families. And also, if you can think about your work experience and your volunteering and your extracurriculars, condense that down to the skills you have learned and the reflection you have done. You're probably sick of the word reflection, but it's the main thing in medicine. They always want you to reflect on every single experience you've had, every single lesson you have learned. Condense it down to the lessons you've learned and the skills you've got, because at the end of the day, the interviewers are looking for your transferable skills and your reflection. And one thing to note is interviews love the question, why medicine? They will ask you, why have you chosen medicine? And a lot of people say, because I want to help someone. And then their follow-up question is, why didn't you go into nursing or pharmacy or midwifery? Because or dentistry, all of those, you can still help people, but you've chosen medicine specifically. So they'll ask you. And a good thing to say is something like, I like making decisions. So I like having the final say at the end of a case. I like being able to look at the whole case, but then make the final decision on how we should proceed. That would be a good answer. Or if you're really interested in surgery, that's another good thing to say. So definitely have a look at questions that you may be asked, and definitely think about your transferable skills and your reflection and exactly why you want to do medicine specifically. Those are the main ones you'll be asked. And then remember, medicine is highly competitive. It sounds a little bit pessimistic to say, but not everyone will get in. Realistically, a lot of you will apply and maybe not get into your first choice, or maybe not get into medicine at all. And that's completely fine. It's completely okay to not get in on your first attempt. But if you've gotten this far and you're very, very sure that you want to go into medicine, there are a few things that you can do to get in the non-traditional way. So one thing is, it's great to take a gap year. A lot of the people that are in my cohort have taken 1 or maybe 2 gap years before they even come to university. Gap years can be great. You can retake exams, you can build up your volunteering, your work experience, your skills. It's also great if you want to get a job to save up money for university, because if you're going to be in university for 5-6 years and then straight into training after that, it's a lot of expenses. So great to save up money in the meantime. And also, when people go the traditional route and they come straight out of university and straight into medical school, and they're in medical school for 5-6 years, they don't have a lot of time to build up life experience, empathy, communication skills, all of that. Taking a gap year is great for that, because you get life experience. You're out in the real world, you're having to deal with situations as they come. So gap year is great for that. If you don't want to take a gap year, then you could do a different undergraduate course. So if you did a different science course, biomedical sciences, biotech, biochem, they can be great, because you're still continuing further education. You're still getting that exposure to science and medicine that you'd want to continue. But you get a bit of experience. So you can either convert after your first year if you're doing a science course. I think definitely have a look at specific universities, because not all universities do this. I know that Nottingham does not allow conversion after the first year, because we do intercalation in our 3rd year. So definitely have a look at that, but you can convert after your first year for some universities. Look at the requirements for that as well, because I think they expect you to be working at a first. So that would be above 70%, which is quite hard at university. So definitely have a look at that. Or if you're doing another course, you can graduate from that course. You can finish that course, have an undergraduate, and do graduate entry medicine, which is also a great path. Graduate entry medicine is usually 4 years, I think. so it's a bit shorter. So all in all, you do your 3-year undergrad and then 4 years of graduate entry medicine, so you'd be done in 7 years. Again, you're not losing much time, it's just an extra year than some traditional medical courses, but you still get a lot of experience. It's still a very good route, and sometimes the graduate entry medicine students are a little bit better than the traditional ones because they've had that university experience before, they've had all that exposure, and so they're coming in and they know what works best for them in terms of revision techniques, things like that. It's great. And then depending on your background, you can also apply for a widening access program or contextual offers. So if you're coming from an area that doesn't have a high volume of students going into a wider education, or if you're the first generation of higher education students in your family, so if not a lot of people before you in your family have gone to university, then you may qualify for a widening access program or contextual offer. And usually the entry requirements are a bit lower. So it might be, instead of 3 A's, it might be 3 B's or BBC or something like that. Widening access programs, they usually tend to be a little bit longer. So you do a foundation year first. So it might be a 6-year course. I know that Nottingham offers one. I know that Manchester offers one. So have a look into them as well, because they're great to apply to as well. But yeah, just remember, going the traditional route is fine, but if you don't get in, that's completely fine. You've still got other options to get through.
Okay, thank you all for listening. So that's it for our presentation today. So I think we can move on to the Q&A. So thank you all for listening, and we're open to take any questions now.